Hi, this is Dr. Mary Kathleen Figaro coming to you from the Diabetes Channel. PCOS is a precursor of type 2 diabetes. And PCOS often happens in the worst time in a woman's life when she is intending to become fertile. Many times before, she's had a period that was irregular and a sense of that her periods weren't happening as they should. Maybe a little bloating, lots of bleeding, having crampy periods, lot of blood, and spotting between periods. All these occur in women who have PCOS. And often when the evaluation for PCOS comes, and that can come at the time when the woman wants to be fertile, then you see the string of pearls. You see the changes that happen on ultrasound that tell you that many times ovulation has not happened. The body has attempted to ovulate, but it hasn't occurred. So what can you do next when you find out this happens, especially if you're interested in fertility and you realize that your fertility is not optimal? Well, one thing that I would recommend is that you find a local endocrinologist who can help you to figure out the different problems related to your fertility and what could be the components of fertility. And it may be PCOS, but it may also be another condition, hyperprolactinemia, which is more common in PCOS, problems with the sperm of your partner, problems with the anatomy of your fallopian tube or your uterus that make it harder to become pregnant. So say you find out that polycystic ovarian syndrome, or PCOS, is the reason why you're infertile. Well, there are many treatments for PCOS, and so you'll have to discuss that with an endocrinologist. I wanted today to discuss one of the two popular treatments, one of them being spironolactone and the other one being metformin. Spironolactone has been used in PCOS almost from the beginning because it is not only a blocker of aldosterone and is used therefore for the condition called hyperaldosteronism, but it's also a blocker of dihydrotestosterone. And the excess of testosterone is one of the components that causes ovulation to misfire. And for a woman to have several eggs, none of which becomes the primary egg and none of them leads to ovulation in a given month. And so getting to the point where a woman can ovulate regularly can not only help the symptoms of bloating, abdominal pain, cyst rupture, even leading to emergency room visits and admissions or loss of one of the ovaries. But with that regulation and that lowering in testosterone, a lot of beauty side effects come about. Less hair on chin, more hair on head, less pigment changes, especially around the neck and around the knuckles, and generally a better feeling. And it's true that some women cannot do well with spironolactone, but there's a reason why it becomes the primary drug in PCOS, because it is very effective over time for decreasing testosterone levels. Also with spironolactone is metformin. Metformin at lower or higher doses, depending on the size of the woman, depending on her ability to deal with the side effects of metformin on the GI tract, is very helpful too, and has been found in multiple studies to improve fertility in women with PCOS. These two drugs can be used together. They can be used apart. One can be used at one part of life and another used at another. When someone is really intent on becoming fertile with PCOS and having a child, metformin becomes more important if it's tolerated, while spironolactone has to be considered off in case the fetus turns out to be a male. And so that going between these two drugs is often a good therapy. And so you may ask, why use these two drugs than an oral contraceptive pill, which is often the first step when someone has PCOS? And that is a good question. OCPs definitely just take over and they make the ovulation regular, and they can keep cysts from forming, and they can keep pain and the bloating away, and certainly any period problems they can help. And if that's the place where you are with PCOS, then it makes sense to use the oral contraceptive pills, but they really don't modify many of the underlying problems with PCOS. So most women will end up with one of those two medications. There are 3 other medications, and we may discuss them at another video, But I wanted to get some of your questions and any input you have, and please feel free to post questions below, and to subscribe if you'd like.